Tonight in Medical Rounds, a groundbreaking new study is changing the way doctors are able to treat people who have a stroke. And Dr. Mark Alberts is the physician-in-chief at the Hartford HealthCare Ayer Neuroscience Institute. He is here to tell us all about these protocols that can really make a difference. Thanks for joining us tonight, Dr. Alberts.
Thank you, Denise.
Okay, let's get right to it. Tell us about the protocols and what they mean for stroke patients.
Well, these two new studies called Dawn and Diffuse, they give patients hope. Patients with the worst types of strokes, that we can go up into their brain up to 24 hours after stroke onset and reverse the effects of the stroke, and in some cases make the patients all better.
24 hours after the onset of the stroke? My goodness. Which type of stroke patient? I know there's two types of stroke, if I remember my biology. Ischemic, which is the clot, and hemorrhagic, which is the bleed. Which of the two would benefit from the new protocols?
It is ischemic strokes, and these are the most common types of strokes. About 80 to 85% of all strokes are ischemic. So we're talking about a new treatment protocol for the most common types of strokes, especially the big bad ones that put people in a wheelchair for the rest of their life.
This is so promising. And take us through the process. What happens when a person who is suffering an ischemic stroke or a blood clot blocking the blood flow to the brain, what happens to them when they come in?
Well, this new process, and the key to it is selecting the right patient. And we have to do a special imaging scan called a rapid scan. And what Hartford HealthCare has done is that we have invested the resources to be able to do these special scans throughout our system. So no matter which hospital the patient goes to, they get the special rapid scan at that hospital. And if they have a good profile, meaning that they're salvageable brain on the rapid scan, then we bring them to Hartford Hospital and do the special treatment, which is going up in their brain with a special catheter, a special tube. We grab onto the clot, we pull it out of the brain so that blood flow is restored.
That's
but this is
fantastic.
only good for selected patients.
And, you know, we have a few seconds left, and I think this is a great opportunity. Dr. Alberts, you know better than anyone how delaying treatment for a stroke can make all the difference in the world. Why don't we, with the few seconds we have left, talk about the signs of a stroke and how people should respond?
Right. Some of the key signs of a stroke is sudden onset of weakness, trouble walking, trouble talking, especially if it's on one side of their body. If these symptoms come on rapidly and they've never had them before, they should call 911, get to a stroke center, hospital as soon as possible.
All right. Great information tonight, Dr. Alberts, and keep up the great work there. It's so nice to know that function can be preserved if you're having a stroke, if you get medical attention quickly. Thank you again.